Hello, and welcome to Joint Ventures. In this OSC original podcast, we tackle the latest medical news impacting musculoskeletal medicine. We go past the headlines to really evaluate the science to help you make decisions about your healthcare. And right now, it seems like every headline is about AI and its emerging role in medicine. I'm Dr. Jenny Andrus, and I'm an interventional pain management physician at Orthopedic and Spine Center in Newport News, Virginia.
And I'm Dr. Mark McFarland, and I'm an orthopedic spine surgeon at OSC. Just about every day, I see something about how AI is going to be superior to doctors in diagnosing or in providing medical advice. AI is using pattern recognition to put together a lot of data at once, really almost instantly. So I can see where it is at least would be a good tool to help providers put together a lot of complex information. A small study out of the University of Virginia recently showed that when physicians made a diagnosis using conventional tools like a commonly used resource called UpToDate, or when they used ChatGPT, they were similarly accurate. But when ChatGPT was used alone, it was more accurate. This suggests that if physicians were trained on how to use ChatGPT more efficiently, this can improve diagnostic accuracy.
So the question becomes, can ChatGPT actually give useful advice on the kinds of questions that we hear every day? I'll admit, I am not the most tech-savvy person, and this is my first real dive into AI. But I'm curious. So let's test out with some of the most common questions we hear in our clinic. So Dr. McFarland, why do I have back pain? ChatGPT says that back pain can come from muscle strains, poor posture, lack of core strength, or herniated disc and arthritis. It even notes some more serious causes like infections or cancer.
That's a big topic. ChatGPT isn't wrong. Your back is made of muscles, bones, nerves, joints, ligaments, and intervening connective tissue called discs. Any one of these structures can become torn, strained, inflamed, infected, or ruptured and lead to back pain. Progressive spinal degeneration or acute injury can cause this pain. Conditions outside the back, such as organ damage, pelvic abnormalities, or even cancers, at times can refer pain to the back and mimic a spinal problem. This delays diagnosis or correct treatment. A thorough physical examination and history assessing all of these possibilities is required to develop a reasonable differential and initiate early corrective treatment options.
I agree. All right, question 2. How did I get arthritis in my spine? Well, AI explains it as largely due to aging.
Arthritis is an inevitable consequence of aging. Life is motion, and motion promotes wear. Our bodies are very mechanical, and we are all aware that mechanical objects wear out over time. Some major accelerators include trauma or injury to your spine, excessive weight, damaging and overloading the spinal anatomy, and general genetic predisposition to connective tissue disorders. Over time, our spines become less flexible, lose hydration, and progressively degenerate, leading to loss of anatomical height, posture, and strength. Bone spurs and bulging discs lead to increased back or leg complaints, requiring evaluation by a trained professional. Lack of exercise and core strength that develops as we age speeds this inevitable condition.
Yeah, genetics is key there, for sure. All right, question 3. What's the best way to treat back pain? ChatGPT gives a full list. Start with rest, but not too much, right? Use ice or heat, depending on the stage, and take over-the-counter anti-inflammatories.
I agree. Most occurrences of back pain are short-lived and recover within 2 weeks. Initial treatments include ice if the injury is traumatic, heat, anti-inflammatory medications, muscle relaxants, oral or injectable steroids, massage therapy, chiropractic treatments, or general spinal therapy. A professional will help decide which of these treatments is most likely to resolve your pain quickly. Weight loss, proper lifting techniques, and continued core strengthening will help prevent reoccurrences. In more intractable situations or severe pain or even neurogenic pain that's unresponsive to early treatment, we will obtain high-definition imaging studies such as X-rays, CT scans, or MRIs to fully evaluate a patient's pathology and confirm the primary pain generator. This helps us to utilize interventional procedures such as spinal epidurals, facet joint injections, and ablations to help resolve pain. If the pathology is deemed severe or it's intractable to these conservative options, surgical solutions such as discectomy, laminectomy, and spinal fusion can be performed as a last resort to treat these conditions.
Okay, question 4, which is the one that you're going to hear. Do I need surgery on my back? Well, according to ChatGPT, surgery is only for specific cases, herniated disc, spinal stenosis, or slipped vertebrae that don't improve. And that is true.
Yeah, the vast majority of patients, more than 95%, do not ultimately need spinal surgery. Most conditions respond favorably to conservative care that we give. Those patients that do not respond to conservative options, they have pain or numbness or weakness that is not improved, or imaging studies that clearly demonstrate a condition that we would not traditionally expect to respond to non-surgical options. Those patients become indications for spinal surgical correction. This can include very minimally invasive options such as outpatient discectomy, laminotomy, or laminectomies. This may, however, include more maximally invasive spinal fusion procedures or disc arthroplasty options. Sometimes spinal motion can be saved, as in a disc replacement, but other conditions may require multi-level spinal stabilization and fusion, leading to decreased flexibility of the surgical segments. Only a highly trained spinal surgeon can differentiate the type and the complexity of the procedure that is felt to most likely resolve a patient's back pain or their extremity concerns.
All right, now this question I hear just about every day. Is my back arthritis just going to get worse? Well, ChatGPT says that arthritis is progressive but manageable, and it highlights the importance of staying active, maintaining good posture, and maintaining healthy weight.
I completely agree. Arthritis is a progressive disease and does slowly worsen over time. But that does not mean your symptoms will worsen or that your lifestyle will have to suffer because of it. The degenerative changes of the spine can be slowed and controlled with proper body posture, with proper lifting mechanics, with proper weight to decrease stress on the spine, with core strengthening and flexibility exercises to prevent the stiffness that promote stability of the spine, proper medications to decrease muscle spasticity and remove inflammation that will lead to progressive arthrosis and symptom generation. A trained professional can assist a patient to make the proper lifestyle modifications and treatment plans to slow or prevent the need for recurrent or invasive options, such as surgery.
Okay, so what do you think? Is ChatGPT a helpful tool for patients?
While ChatGPT shows promise for applications in healthcare, it has significant current limitations in clinical accuracy, reasoning, bias, and privacy concerns for sure. As patients, we should use ChatGPT and other AI platforms to be informed about our medical care, but it should not ever be considered a substitute for professional medical advice. See your doctor, but stay informed.
Okay, sounds reasonable to me. You still need to see your doctor. That's the answer. So thank you so much for tuning in today. If you enjoyed this episode, please like it, subscribe it, share it with your friends. Until next time, wishing you good health and strong backs. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.